Evening everyone. So this is Vamshi Krishna. So in this video we're going to see some of the basic questions. So the first question is deficiency of vitamin B1 may cause. So when the person is having deficiency of the vitamin B1, which disease may which of the disorder can be occur? Options are beriberi, stomatitis, pellagra and peripheral neuropathy. So the right one is beriberi. So the what is the vitamin B1 name? That is thiamine. Thiamine is a vitamin B1. So the right answer is option A, beriberi. So the next question is newborn baby weight loss in first week of life. So after the birth of the baby, after within a 1 week, which how much of the weight can be lose? Options are 1%, 5%, 10%, 13%. So the right one is option C, 10%. So the 10% of the weight loss can be occur in the first week, and in the second week the weight which is lost, it can be regained. Okay, so the right option is 10%. So the next one is a child born to a diabetic mother can have. So the child has born with a diabetic mother. So what may be the condition of that baby? Options are option A, hypoglycemia, hyperglycemia, hyperlipidemia, hyperthermia. So the right one is option A, hypoglycemia. Why? Because in the womb, okay, so in the womb, the mother has high high level of insulin. Okay, so in this situation, the mother having diabetes. So when the baby came out from the womb, immediately the baby can have hypoglycemia, that is decreasing of glucose in the blood. Why? Because there is a change after the birth of the baby. So so when the mother is having diabetic, so the child may have the hypoglycemia. So we need to look after the baby for the glucose level in the blood. So the next one is a baby age at 7 months can do. So when the baby is having the age of 7 months, so the baby can do what? Options are saying mama, crying, walking, and stand without support. So the right one is option A, saying a simple words like mama or papa or something else. Okay, so at the age of 7 months the baby can say some of the simple words. The next one is a caput succedaneum resolves within. Okay, so caput succedaneum is nothing but it is a baby head. Okay, so caput succedaneum is nothing but a collection of blood or fluid. So at the head, okay, that is cranium, back of the head. So there is a collection of fluid, otherwise blood. So within how many days it can be resolved? Resolve is nothing but it decreases. Okay, it will become normal. Options are 7 days, 6 days, 5 days, 10 days. So what may be the right answer? That is option A, 7 days. So within the 7 days, the resolving of caput succedaneum may be happen. So the next one is mother breast milk protect from malaria with the presence of. So in the breast milk, so which one is present to protect from the malaria? Options are IgA, bifidus, factor, and lactoferrin, para amino benzoic acid. So what is the right answer? Option D, para amino benzoic acid, due to the presence of PABA. So due to the presence of PABA in the breast milk, there is a protection from the malaria. So malaria is transmitted from the mosquitoes. Okay. So the next one is which leopard maneuver is used to assess the fetal attitude during abdominal palpation of antenatal mother? Options are first, second, third, fourth. So what is the right answer? Option D. Option D is the right one. So in the fourth maneuver, we can assess the fetal abdomen. Okay, fetal attitude. Okay, so that is fourth maneuver. So we will see leopard maneuvers. So in the case of first one, okay, so in the case of first one, we are palpating the fundus, okay, fundus of the uterus with our right hand. Okay, the superior surface of the fundus is palpated to determine the consistency, shape, and mobility. So this is the first maneuver. And the second maneuver is both sides of the uterus are palpated. Okay, both sides of the uterus are palpated to determine the direction of the fetal back is facing. So here we are palpating the both sides of the uterus. So we can palpate the back of the baby. Okay, so to palpate the back of the baby and the direction of the baby position, so we can assess by the second maneuver. So when come to the third maneuver, it is for to determine the part of the fetus at inlet. Inlet is nothing but the pelvic inlet. So here we are assessing with our one hand. Okay, with one hand we are assessing. So to check the fetal head, whether it is the fetal head is whether it is present in the inlet or whether it's having the mobility. Mobility is nothing but movement. And when come to the fourth maneuver, to determine the fetal attitude and degree of fetal extension into the pelvis. So fetal attitude is nothing but it is a position of the fetus. Okay, whether it is longitudinal or vertical or horizontal. Okay, to assess the attitude of the baby by the fourth maneuver, and to determine the fetal head in the inlet by the third maneuver. Second one is the fetal back and legs, and the first one is the fundus of the uterus to determine the shape and mobility. So this is the leopard maneuvers. So the next one is human sign is positive in the case of. Options are multiple leg fractures, deep vein thrombosis, hemiplegia, meningitis. So the right one is option B, deep vein thrombosis. So in the case of deep vein thrombosis, we have the human sign positive. Okay, so in the case of meningitis, we will have the Kernick sign, or Kernick sign is present in the meningitis. Human sign is present in the deep vein thrombosis. And the last one is placenta separation from the edges is the name. Okay, so placenta after the delivery of the baby, okay, so after the delivery of the fetus, it turns to the baby. Okay, so we call it as a baby. So after the delivery of the baby, the placenta also has to separate from the uterus. So when it is separate from the edges is nothing but this is the placenta. So the separation is the starting from the edges, it is called. Options are Matsudakan, abruptio placenta, placenta previa, Stulus. So what is the name of this mechanism? The right name is Matthews Duncan. So this is the right option. Matthews Duncan is nothing but separation of the placenta from the edges. So here you can see the placenta and the uterus is separated here, but here it is not separated. So this is called Matsudakan. And the Stulus mechanism is nothing but the placenta is separated from the center of the uterus. So edges are still intact. Okay, the edges of the placenta is still attached to the uterus, but in the center part it is divided. Okay, deviated. That is nothing but Stulus mechanism. Matthews mechanism is from the edges, Stulus mechanism is from the center of the uterus. So this is end of my class, guys. Thank you for watching.